parents, I guess, as well. So my talk is to talk about orthopedics and maybe perhaps tempt you to become an orthopedic surgeon. And that's me. And that's you, okay? But actually after the weather, we're all like this. Good. So now, what is trauma and orthopedics? Yeah. So it's a surgical specialty dealing with bones, tendons, joints, and injuries. There are two sort of subspecialties. One is trauma, where there are broken bones and injuries, and we also deal with elective procedures like a hip and knee replacement, sports injuries, deformity correction, and all those things. Okay. Now this is an ankle fracture. See, that's a broken bone and it's been fixed. Probably by Mr. Mumtaz. He's a foot and ankle surgeon. And that's a forearm fracture. You see that? Then that's a thigh bone. We got it fixed with a rod and they heal. It's a remarkable treatment option. Previously, the patients used to be lying in the bed for 3 months, something like that. Okay, that's a hip fracture, and we do joint replacements as well. Why orthopedics exciting? Of course, we work with our excellent anesthetic colleagues and their staff. Immediate impact. I don't think there's any specialty which can say that you can do something and that changes life so fast. I can see, obviously, and we have a lot of gadgets to play with, okay? And wide variety from children to elderly, emergency to elective surgeons. You have a wide variety. You don't know what's going to come to you. And hands-on practical problem solving skills. Okay. It's hard work. They carry in UK. This is what the current version. 5-6 years of medical schools and foundation. January minus 30 degrees centigrade, but still survived, and I'm here. And then you become a consultant surgeon. It's worth it? I think so. You can transform patients' lives, restore independence. That's the thing, very, very important. And there's a global demand for orthopedic surgeons. Trauma is going to never be stopped, and elderly patients, arthritis, that's never-ending problem as well. And research and innovation opportunities. The field keeps on advancing with material science and technology and financial rewarding, and I think we should respect the specialty, at least I think so. What skills do you need? That's again very, very important. Orthopedic surgeons are different beasts. You should have a curiosity and problem solving, need dexterity and surgical skills, empathy and communication. That's very important for all fields. Physical stamina and focus. I'll come to that in a minute. Teamwork and leadership. We work with so many people, theatre staff, ward staff, anaesthetists, and it's important to work in a team to have the best outcome for the patients. And that's a question. Said, you have more brain? We are a bit wrong. That's a typical stereotyping of orthopedic surgeons. There are a lot of jokes on orthopedic surgeons if you look at that. Anybody know the answer for this? What's the difference between orthopedic surgeons and the rhinoceros? This is what? One has thick skin, small brain, and charges a lot. And other is a rhinoceros. Okay? But really, do you need to be a rhino? I don't think so. That's a theory. That's me as a trainee. And I was trained in South Wales. If you want to get a shit review, you need to be a rugby player with a broken nose, 6 foot. That's how the orthopedic surgeons were, okay? I wear an anomaly. But actually, you don't need to be that strong and things like that. It's more about technique and skills. Things. We have women in orthopedics as well now. And you're going to talk about women in surgery, isn't it? Yeah, that's very important. Everybody's welcome. You don't need too much of power. Now, Ysbyty Gwynedd is a small district hospital, general hospital, but I think we are punching above our weight. And I'll go through that in a minute. That's my colleague, Mr. Ysbyty, going green, not with the scrubs, but actually going green. NHS produces so much of carbon dioxide footprint. Anything we can do to improve would be better. And if you look here, he has done a lot of work on reducing the trays and draping, and that's been considered as a gold standard now. And it reduced the clinical waste by 68% and the annual saving of 89 million and so much of carbon dioxide saving. This is being now sort of adopted widespreadly throughout UK as well. Mr. Mumtaz is sitting here quietly. He's a renowned foot and ankle surgeon, ankle replacement, a very, very niche specialty. He's now going to be #1 in UK, whole of UK, not in Wales, whole of UK. And I asked this question, ChatGPT. We do ChatGPT as well. Yeah. What's the future for orthopedics? And this is the answer. Personalized surgery tailored to each patient, robotics and AI planning, day-case joint replacement, and global collaboration and research. That's what it says those 2 days ago. But actually, Bangor, future is there. We're doing most of the things. And we are the first hospital in UK to start the virtual joint school. And this started during the COVID period, where we put a lot of YouTube videos, Catherine helped with that. And then they have an interactive Zoom meeting, so patients don't need to travel, and CO2 footprint training and time saving as well. And there are a lot of videos, and the patients can watch that. One of the videos has like 75,000 views. I don't know whether you get any royalty for that, Catherine. Day surgery, hip and knee replacement. Usually patients just stay for a week, a few days at least. But again, we started for making everything faster, safer, and using the Formula 1 principle. If you look at how it was before, is there sound coming or not? I don't know.
Tire. Lou Moore himself changes the tire.
That's how they used to manage patients, the post-op period. Everything used to happen one by one, and you have 1 day of physio, start with the walker, the next day will be crutches, next day will be stairs. That's how it used to.
A crewman polishes the windshield as Holland moves away just 67 seconds after he stops.
Doing everything better, faster, coordinated, and at the same time safer, like this. They are still safe, but that's what we're doing. Patient going home within a few hours of surgery. Safe. And minimally invasive hip replacements. Traditional hip replacements, long incisions. Again, patients need to be careful for 3 months or so, driving and all those things. That's the status, even majority of the hospitals. For the past year or so, me and one of my colleagues have started this, what we call as a minimally invasive direct inferior approach called the big knee incision. It's widespread in US, but it's only in 2% of the hip replacements are done in the UK with this approach. That's how the incision looks, 6-7 centimeter incision. It's a completely different way of doing a hip replacement, and the patients do remarkably well. And this guy was driving at 2 weeks after hip replacements, and this is 6 weeks after surgery. That's absolutely not possible after hip replacement, the standard way of doing it. This lady is a dancer, saw me 5 years ago. She's very hypermobile as well, ballet dancer, has a dance school, she has arthritis. I explained to her about all the precautions, she can't do a lot of things. Then we waited and waited, and again she couldn't tolerate, came last year when I started doing this, and I offered this as a possibility. She had this, and this is 3 months after surgery. She's already done the dance program. That's absolutely not possible with the standard hip replacement. Robotic knee replacement. We are the only NHS hospital in Wales to have this. Traditionally, this is how all the knee replacements used to be doing. It's still being done as well. And that's how the robot looks. And what we do like a personalized planning. So we put infrared trackers and check all the balance, and then we do what we call a 4D planning. We can see so much data, and we can change it by 0.5 millimeter, 0.5 degree. Basically, it's like a resurfacing or filling the pothole. We can see how much is the defect and then change everything. And then once it's done, we tell the robot it's an assistant. It's not a full, it doesn't do the operation, it's an assistant. It's called as a ROSA in this case, it's called a robotic surgical assistant. And then the robot knows where the bone is exactly. And when I say yes, then it brings the cutting guide like that. Then I don't need to rely on eyeballing. Then I can do all the cuts like this. And we find, but the personalized cuts, more patients seem to be happier and faster recovery. This is the patient from the ward, less than 24 hours after knee replacement. Going home, walking unaided, and waving bye to staff. Again, that's absolutely not normal after a standard knee replacement. And if you look at the outcome, this is the outcome scores. We call this Oxford score. The average score is 35 out of 48 with the natural joint registry. Looked at my 50 consecutive knee replacements. The score is 45. That's significant improvement compared to what is in the literature. Technology. I think this might be there in the stands. Anybody use these Apple devices or Microsoft hardware devices? It's a virtual reality thing. So we are the first hospital to use it during robotic surgery. Like this is a short clip.
Let's learn how to rotate a hologram. Move your hand
Just showing
closer
how
to
it
the
works.
flower. Once the box appears,
The
grab and
hologram
hold
you
one
can
of the
see.
handles on the
And
sides of the
actually you can
box.
have like a
Then
feeling
drag
of
it
that
sideways until the
being
flower
touched.
faces you and opens.
Some of the data staff played with this.
Great. Now, next, we will show you how to open and close the start menu. Here's how to do it. Hold your palm facing you and tap the hologram that appears on your wrist. Tap the hologram again to close the start menu.
And then say goodbye to the technician. And personalized post-operative care. And again, the standard way of treatment is that everybody gets the same treatment, physiotherapy every week, and that sort of thing, because we need to personalize. Because if somebody is from Holyhead, why do they have to come all the way here if they don't need to come? So we started using what he calls a My Mobility app, and that has an AI feature where we can check the range of movement after knee replacement. We are the first hospital in UK to implement this. In fact, she's the first patient in UK to do this. She's demonstrating what happens. So when you press with a phone at home, they can show this app, and then it can check the range of movement, and the AI will detect how many degrees, and then it goes into the dashboard, and the clinical team can see. It's like that. You can see how her range of movement is improving for a period of time, so she doesn't need to come all the way from Holyhead to here. So that's a big dramatic change. We are just making it widespread now. Training and sharing knowledge, that's very, very important. We are a robotic training center. We have surgeons from Europe coming to see us as well. A glimpse into the future. This is the real future. Next few years, hopefully. Completely autonomous robots. So, hopefully, AI will plan and it does all the surgery. You just need to go into the implant, or implant can be done by them as well. That's not, it's actually there, it's just not being found in the clinical setting. In a few years' time, it'll be here in Ysbyty Gwynedd, I'm sure. So take-home message, orthopedics is about restoring lives, not just fixing bones. Combine science, technology, teamwork, compassion. Challenging, definitely, but immensely rewarding career. Just going to put this guy, we did it in COVID period, 2020, and you can see all the masks, and he's been waiting for a long time for his knee replacement. He's struggling, and then we offered him day surgery knee replacement. And actually this video is the one which it's in the YouTube, and it's got 75,000 views, and he, I don't know why this sound is not coming.
How are you feeling?
Nervous.
So basically,
apprehensive,
he was very, very apprehensive as expected.
A little bit positive
Then
about
we
it.
did the operation,
Hopefully
and then
it's
we
going
did
to
all
be
the physio,
straightforward and
everything.
we're going to walk out of
And,
here tonight.
He went home
Right,
the
this
same
is the
evening,
team which helped
and
during
came
the
actually
operation,
walked to theatre,
Lovely.
thank all the
and
staff.
you've done very well.
Yeah.
Probably normally you'd gone home in 2 more days' time, but you're already
Okay.
ready to go home.
Would you say I've done well?
Yes.
It was nice
ultimately
it's
it's
quite
up
a nice
to you as well.
video.
She's doing all the work as well. Right. Okay. Excellent.
Oh, right.
Following his wife.
You can call for me now. I'm ready.
Oh, you miss me? Yes, we've all missed you. How you doing? Hey. Hang on, let's do it. You've been a great team. And yeah, it's nice to go home. But thank you very much for all you've done. Thank you, Mr. Ganapathi.
You're welcome.
Okay. Talk soon.
Oh, I have to ask, Mr. Todd, how do you feel about being able to take him home
She was
today?
quite scared
Wonderful.
as well.
All on the same day?
Absolutely wonderful. And his daughter and his granddaughter are loving it as well.
Bringing him into the hospital.
Well,
For
yes,
us,
of
it's
course.
like a routine
Yeah,
procedure
yeah,
for
yeah.
every patient.
Of course you are. Worried it's a big operation, isn't it? And it's really the first big operation he's had since I've known him. So that's 30 odd years. So yeah, I was. But I've had a tense day.
Well done.
I want to get him home.
Bye.
All right, bye.
So that's what I was talking about. Surgery and medical. Thank you.